If you're a gastroenterologist and you have a patient that you think GI psych or even general psych would be useful for, but they're pretty disinterested or skeptical about psychology in general, these are some things that I recommend addressing with the patient that may help them decide to try it. One of the things is to align with the skepticism, is to say it's good for you to be skeptical of psychology and of therapy in general. That profession has done a lot of harm. And also, just like any profession, there are people who are effective and good at what they do, and there are people who aren't as effective or good at what they do. And so, really aligning with them can actually help them feel like you know where they're coming from. The second thing is that as a clinician, I always welcome the skepticism, and we should encourage our clients or our patients to bring it up with the therapist. The therapist should be able to have a collaborative discussion about it, and if the therapist doesn't handle the conversation well, then the person should find a different provider. The third thing is that it can help a lot if you ask them to try it for 1 to 3 sessions. And if they really don't even want to commit to between 2 and 3 sessions, then ask them to go to one and say that they don't even have to meet the whole time if they don't find it valuable. And I recommend to patients in the beginning of the session, let the therapist know that you don't really want to be there and that you're not even sure how this would even be helpful, but that you're doing it because your doctor wants you to. And if you don't find the visit helpful, you want to end early. That's completely appropriate. And the therapist should be able to handle that just fine. The fourth thing is that sometimes because of the way that people were brought up or because of the way that mental health is discussed in their communities, there's the messaging of it's all in your head. Like we send people to psych when there's things wrong up here. And one of the things that I try to help patients understand is it's not that we think things are going wrong in your brain. It's more like there's behaviors and ways that we respond to aspects of our lives that affect our GI tract, whether or not we notice them. And oftentimes, the things that we can do actually exacerbate our symptoms. And this is true for people who have physical abnormalities and for people who don't. And the point of meeting with a GI psych provider is to help uncover some of these unnoticed relationships between our behaviors and our symptoms to help shift the focus there where we can really make a difference. The last thing is that if, even with bringing up those points, your patient is still like, I don't know about this, the fifth thing would be to ask them, can I bring this up again in the future? Is this something I can bring up at our next visit or in 2 visits? And then make a little note to yourself to remember to bring it up and address it again. Between those things, generally, that can help people to make the choice to give psych a chance in making a difference and helping them feel better. I hope this is helpful.